Diary entry number 34, Therapy and Doctor Visits. Welcome back to the Nervous System Diaries. Once I was settled into the shelter and I realized I couldn't see the doctor super quick, I started looking for therapists. I actually found one pretty quickly, and thankfully she offered online sessions. That was perfect for me because I could do therapy right from my room, or at least I thought. My room was the only room downstairs, and unfortunately it was right next to the kitchen and the family playroom. I asked staff if they could simply remind everyone to keep the noise down for the hour I was in therapy. I thought the women in the shelter would understand. I wasn't asking for special treatment. I was just trying to get mental health treatment after 16 years of abuse. But the staff told me they weren't going to ask everyone to be quiet because that would be considered giving me special treatment. They did give me another option. I could use the pet room for my therapy session. The only problem is I had to take Pup with me, and Pup was incredibly anxious. Every unfamiliar sound made him bark. So my first therapy sessions weren't exactly peaceful. I'd be sitting there trying to talk about years of trauma while Pup was barking. Doors were slamming, people were yelling, and children were running back and forth outside the door. It was nerve-wracking. I was already nervous because this was the first time in my life that I had ever gone to therapy for my trauma. The strange thing was, talking about what happened wasn't actually the hardest part. I was really good at telling my story. I could tell you exactly what happened. I could tell you around the time it happened. I could tell you who did what. But I wasn't feeling any of it. I spent my entire life learning how to push feelings down so I could survive. My therapist eventually called on, and one day I was telling her about something that happened, and she stopped me. She said something along the lines of, "Wait a second before you go any deeper." In that moment, how did that make you feel? Go back to that moment. Oh my gosh, how I hated that, because suddenly I had to feel it. I started crying. She asked me what I was feeling, and I remember saying I was sad that I had allowed these men to treat me that way, angry at myself because I didn't know how to leave sooner, angry that somewhere along the way I had become a doormat, and I realized that this wasn't something that started with number one. I began learning to put myself last since childhood. That's one of the reasons therapy can be so incredibly hard for survivors. You don't go back into the past because you want to suffer it all over again. You go back because you can't properly heal from something you were forced to bury while you were still surviving it. After about a month into therapy, my therapist had me take the ACEs test, the Adverse Childhood Experiences test, along with the Adult Trauma Assessment. My ACE score was 9 out of 10. The reason why it wasn't a 10 was because there is one childhood experience that I can't clearly say happened. I have pieces of a memory. I have fear surrounding that memory, but I don't have enough clarity to say for certain what happened. My adult trauma score was 7 out of 10. The reason I didn't score higher was because wasn't because I hadn't experienced the trauma. It was because I didn't do drugs or alcohol to cope. I just pushed everything down. I didn't want to feel it. My therapist actually commended me for that. She told me, "You've been through so much, and yet you don't even smoke." Then she told me that at my next appointment, we'd go over my diagnosis. The following week, I was diagnosed with PTSD and anxiety. That was strange for me in that moment, because on one hand, hearing a diagnosis made everything feel real, but on the other hand, it finally gave me words for what I had been experiencing. Then came my first doctor's appointment. I was terrified. I was so far out of my comfort zone that my body was practically having a meltdown. I was shaking, my knees were bouncing uncontrollably. I had prepared a list beforehand because I knew that there were so many things wrong that I wouldn't remember everything once I got there because of nerves. The doctor confirmed the PTSD and anxiety diagnosis and prescribed me medications to help my symptoms, including my night terrors, my sleep, my anxiety. I got prescribed 2 PTSD medications and also one for anxiety. But then she started looking at my physical health, and that's when I realized just how much my body had been struggling. I'm diagnosed with autonomic nervous system dysfunction. Basically, after spending so many years in fight or flight mode, my nervous system had forgotten what normal regulation felt like. Even regulating my body temperature had become difficult. After 16 years of surviving, my body didn't know how to simply exist in safety. My blood work also showed that I was severely deficient in vitamin D and vitamin B12, and I was also anemic. At my next appointment, my doctor started me on supplements and began scheduling me for additional tests. She said she wanted to do an MRI because of suspected traumatic brain injury. She wanted an evaluation of my spinal cord because of the strangulation trauma and the pain in my back and neck. She also ordered speech therapy and physical therapy. And suddenly, I had a whole list of appointments. It was overwhelming, but for the first time, I wasn't ignoring what was wrong with me. I was fully taking care of myself. The doctor explained the abuse and repeated trauma and how it can have lasting effects on the body and brain. And so many things started making sense. The migraines, the speech problems, the brain fog. Sometimes I'll be talking and I can literally see the word in my head. I know exactly what I want to say, but the word just won't come out. It's incredibly frustrating. I also realize how badly I react to loud noises. Anything above a calm, mellow voice can make me want to crawl inside of myself. My therapist recommends noise-canceling headphones. One of my friends actually sent me a pair to the shelter's post office box. That little package meant a lifetime of difference for me. Because I started to understand something. My body wasn't being dramatic. It was responding to years of being unsafe. And unfortunately, the more I started physically feeling, the more emotional it became. The pain triggers me. Because when I feel pain now, sometimes my brain immediately connects it to where the pain came from. And certain pains can remind me of being hit. Another pain can remind me of a certain event. And suddenly, I'm not just feeling today's pain. I'm remembering yesterday's pain too. And it makes me angry. The medication did help me sleep a little better for a while, but the shelter itself made sleep difficult. It was loud. There was a woman there with the 6 kids, and they would sometimes be up late into the night, running up and down the stairs, slamming doors, and blasting the television in the family room right beside my own room. I complained several times. Therapy was teaching me how to set boundaries, and I was actually trying to use those tools. But the staff basically told me kids will be kids. I tried to understand, but I also felt like nobody was really considering pups' needs or mine. So I started distancing myself. I wasn't cooking for everyone as much. I wasn't making desserts. I wasn't trying to be everyone's friend. I was focusing on healing, and honestly, I didn't want anything to do with what was happening around me. Some of the women were drinking and using drugs on the property, which was against the shelter rules. I followed the rules. I didn't want any trouble, but Pup's anxiety became something that could be used against me. I always kept a muzzle on Pup when we were outside of our room. Not because he was aggressive, he wasn't. He was just scared. Think about it from his perspective. He had been taken away from the only home he knew. He had been abused, and then suddenly he's in a completely unfamiliar building, surrounded by strange people, strange voices, slamming doors, screaming kids, and noises that never seemed to stop. He was protecting me. and I was protecting him. Usually, I'd make sure the room was clear before bringing him out. Most people respected that. But one woman decided that she wanted to help, and she told me she wanted to pet Pup and show him that people weren't all bad. I explained to her that she needed to let him come to her. I told her he just wanted to sniff, but instead she kept running around the kitchen counter. I kept telling her that that was making him more anxious. Eventually, I just went ahead and took Pup outside. When I came back in, she was gone, thankfully. Later, she told me I didn't realize how big he was. I laughed. I told her, yeah, he's a big boy, but he's so sweet and funny. I didn't know it then, but that interaction would come back to haunt me. Because somewhere along the way, I believe that some of the women decided I might report them for breaking the shelter rules. And I believe they started making a plan to get me kicked out. That's where I'll pick up next week. Until then, please remember, you are allowed to heal. You are allowed to have boundaries, and you are allowed to take up space while you do it. Stay safe. I'm proud of you. I'm a soft-spoken survivor, and this is the Nervous System Diaries.